Welcome to Impact and Coffee. I'm Robert Nelson. I'm the program manager for Pivotal New Mexico. For now, I'm going to ask folks who are guests in the audience to mute their audio and turn off their video, please, so that we can actually focus on our panel this morning. And talk a little bit about Impact and Coffee. So Impact and Coffee is a welcome conversation to build community within the nonprofit sector. I am co-host, and I'm joined by our wonderful co-host, Michael Green. Hi, Michael. How are you doing this morning?
Hey, everyone. Good morning. I'm well, thank you. Glad to be here. Glad you're all able to join as well.
You know, it's October. I am just really surprised that we're in October already. But it's also Gratitude Tuesday, Michael. Is there anything that you're particularly grateful for today?
I'm thankful for just autumn in general. It's my favorite month, or my favorite season. So I'm excited for the cooler temperatures and to see all of the leaves changing. If you guys haven't been down to the Bosque yet, you should definitely go and check out all the fall foliage and everything. So that's what I'm thankful for. What about you, Robert? What are you thankful for these days, or grateful for?
You know, I'm pretty grateful for the fall weather too. It's nice to actually just go outside in our backyard and hang out in the nice brisk kind of weather and notice all the leaves changing, the balloons out. If there is anyone in our audience who wants to share what they're grateful for too, please do so in the chat. Introduce yourselves, tell us your names, your organizations, what brings you to Impact and Coffee. We want to hear from you in the chat. That'd be really great. And I see a lot of folks, familiar faces in the audience today, so it's really great to see everybody. We're going to go ahead with introductions, and so we have a really great panel today. I'm just going to kick it off to Jules, who is sitting right next to me over here at Enlace Communitario, virtually sitting next to me, not in my kitchen. But Jules, welcome, and thank you so much for joining us here today.
Thank you for having me. This is exciting. I'm Jules Salinas. I'm with Enlace Communitario. We are a domestic violence organization that primarily works with Latino immigrant survivors of domestic violence. And we are located near the airport. So if anybody's over in that area, you're welcome to come by. And my PCPs are he, her, she, her, hers, they, them.
Thank you for that, Jules. Appreciate it. And welcome again. I'm going to send it over to Susan Wilger over at the Center for Health Innovation. Welcome, Susan. Thanks for joining us. It's really great to see you today.
Yeah. Hi, everybody. Thanks for having me. I'm really thrilled to be part of this conversation. I'm the Executive Director for the Center for Health Innovation. We're New Mexico's only public health institute. We've had that designation. It's a national designation that we've had for a few years now. We've actually been around for about 10 years as the Center for Health Innovation. And we have about 20 staff. We're headquartered in Silver City, New Mexico. And I have staff all over the state. We do really a lot of programming as well as advocacy, policy work around public health and related issues. So we'll have a lot to share today, and we'd love to hear from the audience as well.
Thanks, Susan. And last but not least is Nancy Hood, who is no longer at Apex. She's over at Project Echo. We are grateful for Nancy for actually coordinating this group of folks. Welcome, Nancy, to Impact and Coffee, and thanks for joining us today.
Thanks. I appreciate Impact and Coffee being willing to partner with New Mexico evaluators to make this panel happen. I think it's a great marriage. Especially because the word impact is in Impact and Coffee. And so thank you also to Jules and Susan for being willing to be on the panel. And I'm the president of New Mexico Evaluators, so if anybody has any questions about New Mexico Evaluators, I would love to hear from you and chat with you. Thanks to everybody for being here.
Awesome. Thanks, Nancy. And as I remind folks as they enter into the Zoom today, please introduce yourself, tell us your name, your organization, and share what you're grateful for, but also that you mute yourselves and also mute your video too. I really appreciate everyone playing along, playing like a team. I really appreciate that so much. And with that, we will dive into the first question. So it's been it's 7 months. It's October and we're at 7 months now. And it's hard to believe that we're at this point, but it's been so challenging for a lot of folks. Within your own, expertise, within your field of evaluation, how have you seen nonprofits adjust their evaluation plans, or how have you adjusted your own evaluation plan in response to the pandemic? And the second part of that question is, what has become more difficult to evaluate or navigate? What has become easier? And I'll kick it over to Jules first.
So to the first part, I think what's been an interesting, in my observation, is we've seen sort of this collapse of this Maslowian hierarchy of needs, right? And so where evaluation was kind of further up in terms of what we wanted to achieve as an organization, because the Maslowian hierarchy of needs is collapsed down to really this primordial basic needs level for many of our clients and staff, that it's become less of a priority, unfortunately, right? But it's also, I think, shifted. So we take the UNM evaluation lab approach to evaluation, where we're looking at both outputs and outcomes. And so it's really become focusing on outputs at the moment. And I think that we're going to have to see what those outputs tell us in terms of outcomes later on. And because we're shifting also the outputs that we're measuring, right? Because where historically we would look at our intervention services in terms of number of counseling appointments or case management appointments, those very hands-on kind of intervention services, as well as our prevention services, which is our outreach and working with the community. All of those things have shifted so dramatically in terms of how we provide services, how we're doing outreach, how we're looking at all of this in terms of our curriculums and our services and our, even the platforms in which we're providing them. So because of those shifts, the way that we're measuring has to shift as well. And so I think that that's been our biggest challenge with looking at evaluation right now, is because we're so focused on the moment and meeting the moment that it's hard to see the broader picture of what is the long-term story that's coming out, that's going to emerge from all the immediate data that we're collecting. Does that make sense?
Heck yeah, thank you so much. Susan, would you like to pick up the ball here?
Oh, Susan, I think you're muted.
Sorry about that. So we have about 25 different funding sources, each with a certain level of evaluation. And since COVID hit, in terms of really what's shifted, not so much the actual outcomes that we have, but the actual methods. So for example, one thing we've really had to shift several of our programs involve working with community coalitions and working with school districts. And so that's been a real shift for us. So now that everything's gone virtual, we've had to think more about, okay, how are we going to shift our methods if we cannot be in classrooms and we can't be out in the community doing outreach? And so with that, of course, comes how we change our evaluation of that. So a lot of those have really just changed to virtual meetings, and the impact is going to be, I think we're still in the process of figuring that out. The long-term outcomes really haven't shifted a whole lot. So we're still aimed at increasing healthcare workforce development or lowering substance use in certain communities. What has shifted for us, though, is our response due to COVID. We do a lot of substance use prevention work, for example. And so we know that we're seeing a lot of increases, I should say, in alcohol use and opioid use and various other things. And so what we're really interested in is, how do we get that real-time efficient data in order to track and respond and shift our strategies and methods to still reach our same goals. And so we're doing that. One thing that's really interested to me that I'll share with the group, and I'll put it in chat, is we're really interested in looking at things through an equity lens, especially as COVID hit, because people know that equity issues and disparities have always been there. COVID just really magnified it. And one thing that we're looking at is the CDC, it's called the Social Vulnerability Index, and it's 15 different indicators around 4 different themes that really looks at where our community's most vulnerable. And so that can allow us to say, okay, once we see these vulnerable, the most vulnerable communities, and we try and go down to a census tract level, then how can we respond, with our programming?
Thanks, Susan, for that. And I really appreciate the call out to the social vulnerabilities portion of it. I was just actually looking at some maps, some GIS maps on that last night, nerding out with the Data Collaborative website. I understand that our fourth panelist, Shelly Valdez, has joined us from Native Pathways. Good morning, Shelly. How are you?
Good morning, everyone.
Do you think you could take about a minute or two to introduce yourself and talk a little bit about Native Pathways, please?
Gwatsi watua hiname ko astuita sina hanoksta mayushka washtita ewa kawake. So in English, good morning, everyone. My birth name, my given name is Kuastawita. I am a member of the Pueblo of Laguna tribe. I hail from the Big Turkey clan, and I am a child of the Little Lizard clan. So it's been beautiful to be here with you, and thank you so much for inviting me. I have a company called Native Pathways. I've had the company for 30-plus-ish years, and my passion area is Indigenous science. So science education is the research area that I dive myself into. That was my academic pathway as well as my upbringing. So I know it works. I'm a product of culturally relevancy environment in K through 12 science or education, just education as a whole. And I've been blessed 16, 17 years ago, maybe 20 years ago, to be invited and engage in evaluation. So evaluation is very similar to the science that I'm passionate about. So it's just been a wonderful pathway to tell people's and program stories. So I'm a storyteller, and that's what I feel evaluators are. So good to be here. I'll stop here.
Well, I will kick it back to you in here in just a moment, but the first question we're asking is, how have you seen nonprofits or even community organizations adjust their evaluation plans in response to the pandemic? And what has become more difficult to evaluate or navigate, or what may have become easier for organizations too? So I'll toss it over to Nancy, and then I'll toss it back over to you, Shelly. How does that sound?
Not a problem.
Awesome. Thank you.
I'm going to beg my initial begging that I wasn't really intending myself to be a panelist with the same level of expertise as our other distinguished panelists. So I'm going to cede the floor to my colleague, Shelly.
Oh my. Okay. All right.
If that's okay, Shelly. And thank you so much for being here.
She disappeared. She's like, no, I'm sorry. You go, Nancy. Actually, Nancy, if you want to take a shot at this question, that'd be really
sure.
Cool, and then we'll.
Yeah. So my work now, I'm the Director of Research and Evaluation at the ECHO Institute, which is at UNM. So our movement is global, and so at the end level, there are people doing the ECHO model in communities in Africa and India and Latin America, and certainly COVID has been a huge piece of the ECHO model has been leveraged to respond to COVID. And I would say the one thing that is most interesting to me is one of my charges is to evaluate our ECHO COVID work in Africa. And for maybe a couple months, I was waiting for things to settle down. I thought, well, we'll get to the point where we can really clarify, which the big projects are responding to COVID, what they're trying to accomplish, who the partners are, who the participants are, and then we'll pick, maybe 3 projects to really dig in deep with evaluation. And I'm kind of embarrassed to say I think it was only last week that I realized, oh my gosh, that is totally not the right approach, because things are never going to settle down. It's never going to be linear. This work is going to continue emerging and evolving. And so we're really looking at very intentionally taking a developmental evaluation approach across this work, which is a little bit different for an academic medical institution. So we're gonna have some interesting navigations along the way. But that's one of my reflections about how evaluation work has changed in light of COVID.
Thanks, Nancy. Shelly, we're going to call on you to see if you'd like to answer this first question.
Sure. Yes. Can you hear me?
Yes, loud and clear.
Okay. There's a loud noise outside, so I apologize. Okay. I love that Susan brought out the inequity in terms of our environments that we're in right now, and so it's really, really emerging. And a lot of the programs that we're working with program evaluation on, they are targeting the indigenous communities. So the inequities is really strong, very, very amplified in those communities. Most of the tribes that we work with have limited access to technology, some of them by choice. But in the K through 12 area, we're seeing the students really struggling. The grandparents, a lot of them are, and the parents are not technology savvy, so they're really trying to help their children engage not only in academia, but in our evaluation activities. And it's really, really, the learning curve is very hard. And so it's very strong. You can see the learning, the frustration emerging. A lot of tribal communities, they're really, they lend themselves more to that physical space. So creating that relationship, and you can do that to a very degree virtually, but you really need that physical interaction so that you can create that relationship and build that trust. So we're seeing challenges around that area. As far as our own work, a lot of our own work is virtually. I mean, we're comfortable using the technology and Zoom. We've always used Zoom to engage with our audiences because they're all across the nation. And so for us, we're okay. It's the communities that we work with that are finding really challenging times, not only for the physical relationship, but also the technology, the limit on technology, limitations. Thank you. I think that's it.
Thanks for bringing that up. I know technology has, been a hallmark of a lot of the challenges we face here in New Mexico, especially in our tribal and rural communities, especially. So with that, I'm going to kick it to Michael for our second question.
All right, thank you, ladies, for those responses. This next question pretty much builds on a lot of what you said. I know Susan has touched on this, but the second question I'm going to ask you all is, have you worked with funders on updating your evaluation plans in response to programmatic changes the organization has had to make during COVID? What has been your experience with that? Because we know everything has changed quite a bit, but specifically with you working with funders, how has that changed? We'll start with you, Jules.
So like Susan, we have about 32 different funders. So we are, ranges from people who are like, hey, do whatever. We're good. We have the absolute trust in that. And to others that are a little bit more hands-on. But even the ones that are hands-on, I think we've built enough of a trusting relationship with all of our funders that they are looking to us to say, what are you finding important to measure right now? And we'll trust that that's what's really important to measure right now. One of our biggest funders actually went from being a program-based funding model to about halfway, I'd say in April or May, they were very responsive and said, you know what, this is now all unrestricted funding. And we're going to throw in another $20,000 on top of what we had already provided, because we know that you need to meet the immediate needs of the community. And so we were so grateful for that. It was actually Kellogg. And that didn't change what we were reporting to Kellogg, but it kind of added to it. So it, obviously we had more outputs to report back on with regards to how did we use that extra funding. But it also has given us the opportunity to look at all of our programs, I think like Shelly was saying, and saying, okay, if this has gone virtual, what does that look like? How does that shift what we're looking at in terms of, again, measuring those outcomes and outputs. And then trying to communicate those changes to the funders to be able to say, this is how we're measuring now. This is why we're measuring now. And we don't really know what to expect. So it's kind of nice because it's not like we're measuring to inform what we thought our impact was going to be, but really this is the stories being created as we move forward here. So it's shifted that in terms of evaluation, and then trying to communicate that to funders to say, like, yeah, we know that, for example, we were going to have 50 kids participating in one of the youth leader events, but that's not really realistic right now. So instead, we're doing this kind of event. This is what we're going to measure. This is still the same hopeful output, or outcome rather, that they're going to understand teen dating violence better. We're going to measure it this way through online surveys rather than going around the room and asking them what they think. So it's just really at every single level shifted the way that we're approaching evaluation, and then also really what we're hopefully looking for in terms of being able to, like Shelly said, tell that story. So.
Thank you, Jules. Yeah, it's interesting the experiences we had where some are very hands-off and others want a little more, be involved a little more. And I think it's all about that transparency that's creating the trust between the organization and the funders, because they trust you that you're going to share the information and do the right thing. So thank you for that. Susan, I'm going to jump over to you. So the same question.
Okay. I have to echo what Jules just said. Our funders have been fantastic. They've been very positive. They've been flexible. They've been very adaptive. They've actually turned to us to say, what do you need to do your work? And so it really hasn't been disruptive as a nonprofit with multiple funding sources. They're also very listening. They're looking to us to provide them with the information on what is the impact that COVID is having. And in a really good, strong example, we work a lot with food systems, and the disruption to our local food value chain was incredible during COVID. And the response had to be very, very quick. What the funders are really good at looking at response and how we evaluate response and getting funding out there and meeting the need. What the funders are not asking, and what we're seeing as nonprofits, is there is that immediate emergency response to COVID, but there are huge structural changes that are needed. This pandemic really is bringing that to light. And so what all of us need to do is work with our funders to say, this is not just an immediate response situation. There are huge underlying structural issues that need long-term investment. And so, that's part of our message that we need to be telling our funders. So as they look at that information, we're not stopping short at this is how we respond in the immediate future. We really are emphasizing the fact that this has really brought up all those structural changes that will require long-time investment. And I do want to mention, as one of our funders is the legislature. And so obviously we have a session coming up real soon. And so, you know, we're also sending that message to our legislators as well.
Thank you for that, Susan. Yeah, it's great that the funders are asking, because that also means that they're listening to the responses that we're giving and they're interested in making those changes. So excellent, thank you. I'll shoot this same question over to you, Shelly.
Sure. Actually, it's really nice. I piggyback again off Susan's information that she shared, her knowledge base, in that we've been blessed with our funders, and we have varied funders from this STEM area to social well-being, to health, to foundation work. And we've been blessed that they've allowed us, through trust, building trust, to navigate what we feel is best for those communities and programs that we work with. In one particular case, we find it, we're really blessed because they're getting it. They're getting that we need more Indigenous evaluators. And so my company works with a colleague. We've been working for the past 16 years, Jill Stein, JKS Consulting, and she comes from that Western conventional evaluation, and I come from the Indigenous lens of process evaluation. And so one of our funders, it's a foundation, has asked us to build local capacity because of the emergent environments that are challenging around COVID with Indigenous communities. So we're going to start breaking ground on that and training local evaluators to house evaluation within their infrastructure. So we're blessed in that case. Again, most of our funding agencies have really been wonderful in allowing us to navigate that space the best way we feel. And one of the things that we're doing because of the challenges, and you're absolutely right, Susan, our programs, particularly the Indigenous tribal communities, right now their concern is survival. They're in survival mode, and we don't need to plague them with evaluation activities. But what we can do is grab their story as they're navigating through this COVID environment. So all across our programs, we've created a set of invitation areas to invite them to share their story about navigating through COVID. And it's really been, number one, emotional. Number two, heartwarming, and number three, ingenuity, about how for most, it's all about, continuing that resilience in this time of challenges that we're in. Thank you.
That's great, thank you. Yeah, I think the survival mode and ingenuity and how to figure out how to deal with everything that's going on is super important right now. So thank you for that. Nancy, did you want to add anything? Or?
I didn't think I had anything to add, but I just wanted to reflect again, the main work I'm doing right now is global and down at the community level once it's there. And even though most of our funders are quite large, sort of global international funders, I think a commonality that I'm seeing that many of you talked about is a shift to thinking about the infrastructure for connecting with and communicating with communities, and the fact that if a program or an organization has connections that are two-way connections with
Thank you, Nancy. Yeah, those connections are a theme that we've been seeing reoccurring in these different panels that we've been hosting over the past 6 or 7 months. And so I definitely see how that is reflected in the evaluation process also. Thank you for that. I'm going to shoot it over to Robert, who has the next question for you all.
I think so. A lot of those points really dovetail into our next question, which is how can effective evaluation help uplift the work of nonprofit organizations? And how have you seen it impact organizations in positive ways? And I will kick it to Shelly for this first one.
Can you repeat? I was just going to ask you if you can repeat.
I can totally do that. How can effective evaluation help uplift the work of nonprofit organizations? And how have you seen it impact organizations in positive ways?
Evaluation, again, going back to that ingenuity, I think, of this particular foundation that says, okay, we need to build capacity, internal capacity, and help our programs create internal evaluation systems so that, you know, we're not traveling and we're not spending so much time on the internet trying to work evaluations, but we're building those local evaluators who can do the on-the-ground work. And so I think that building the infrastructure in terms of creating a portal for evaluation can be understood, and evaluation can work with what the direction that the program wants to go with, versus, you know, a lot of the funding agencies. And so and I think that if anything, the funding agencies really need to look at they're starting to look at their own internal missions and statements and visions for the evaluation and what's required, and kind of shift that paradigm to help harness what is it the local programs, what do they authentically want to evaluate, and that's good, but it's not totally there yet. It's just a little open door in some cases, and I think that, you know, with the local capacity, they're seeing the importance of, particularly at this time, documenting that particular story, because there are unique environments around this pandemic. There are unique, emerging, inviting spaces that we could all learn from. So I really think it's helping build local capacity in varied ways. I hope I answered the question.
Thank you so much for that. I think one of the things that I was thinking about the most as you were talking, and then even your previous answer, was how important data and evaluation are at like advancing equity and social justice. And that's something that Susan touched upon too. And I think that's just, you know, with this question, it's like, what is that greater overall impact that we're trying to define and ascertain, you know, largely in the nonprofit sector? Like, you know, we have so many nonprofits here in New Mexico, all fighting for, you know, for whatever common good it is they're fighting for. And so to hear that, to understand the story too, is so important. Yeah. I'm going to kick it over to Jules. So can you just take a chomp at this question, and, you know, how can effective evaluation help uplift the work of nonprofit organizations, the sector in general, you know?
Yeah, I think that you touched on it, and Shelly touched on it early on too. It tells stories, right? It tells our story, and so in that way, it really lifts up the work that we're doing in a very accessible way that resonates with a lot of people in terms of really being grounded in what's actually going on, right? And so we can point to stories, and we can say both, here's qualitative and quantitative backup to that story, to that experience. And so in that way, I think it's something that, again, and I hate to use resonates because it's such a trendy freaking term, but it really does resonate. People really get it that way, And so I think of one of the examples, one of the evaluation projects that we worked on with UNM was to look at our men's program. And we ended up doing focus groups with the age group of between 18 and 24 young men. And then they basically said, no, you need to bring in the young women too. This cannot be just brought to us. It needs, because we're talking about building a program that's based on changing social norms and really uplifting gender equity. And so we didn't want to do this in this vacuum of, again, only being informed by the men. It's like, no, and it was great to see that the 18 to 24-year-olds really got it. Like, they understood, like, this cannot just be our voice. We already have male privilege. And so we need to bring in the voices of women, of our peers that are women, and to be able to identify what are the issues and what is holding us back from having true gender equity, and how does that lead to violence. And so the program was formed through this evaluative process, through the focus groups, and then going back and looking at the data and having the group, we called them the ninis, ni trabajando ni estudiando, not working and not going to school. But now everybody's a nini, right? Like, a lot of people are ninis that were not before the pandemic. But they were still very interested in telling the stories. They were still very interested in really getting the work out there through social media. And this is before the pandemic. And so when the pandemic hit, this particular group that emerged out of that evaluation process actually was able to hit the ground running in a way that some of the other groups weren't prepared for, because they were already working on how to tell their stories, how to use social media in a way to get out the messaging, really be able to bring in and have it be a gender equitable information. And so I think that's it's an interesting approach, and that was very something that really just took off, and I'm really glad to see it. And I think that demonstrated the need for things like focus groups within the context of evaluation when we're looking at our programs, not just building sterile logic models that aren't rooted in stories, but actually having the logic model be something that is living and breathing and evolving.
I mean, I don't know how many times I've stared at a cold logic model, and even though the logic model itself tells a story, so I'm really glad that we're continuing on that theme. But oftentimes it's like, oh my gosh, what does that even say? So, Susan, we're going to kick it to you.
Yeah, I mean, obviously for nonprofits, being able to use evaluation to show that we are having an impact is always really important to our sector. I think in the current times, having that qualitative methods is really important, really telling those stories and how we can do that effectively and innovatively. I'm always open for looking at new ways of doing that. So we're trying to incorporate that a little bit more into our work. But with my organization, what's also a real challenge for us is when you're dealing with complex social issues and you're in it for the long term, how we can do better about showing the collective impact. Because we know we cannot do our work alone. So if we're trying to diversify the healthcare workforce in New Mexico and make it more accessible so that people have greater access, it's many different people coming together and organizations coming together to have that impact. And quite honestly, we haven't been very good, I think, at showing the long-term story. We're really good about showing snapshots of our work through evaluation. And so if anybody has ideas or suggestions for how we can go about showing that longer term story, that these are multiple steps, but we have our eye on a prize at the end, we're certainly open to hearing suggestions so we know how to do that better in our work.
Susan, I appreciate that. Nancy, is there anything you want to weigh in? I think the one thing that I was thinking about as we're having this part of the conversation is when you and I first met, when you were doing the landscape study with Apex, and some of the story that study really brought about in terms of the sector as a whole. And I just keep on thinking about that swath of like eastern and southeastern New Mexico where there isn't that much nonprofit, not much of a nonprofit footprint. So like whatever, like what happens there, how do we fund that? How do we reach out to folks? You know, and then in various rural communities in New Mexico, like in southwestern New Mexico and northeastern New Mexico, what does that look like? And how do we tell that story more effectively so that folks can actually engage with those organizations, with those communities, and just kind of talk about effective evaluation to uplift the work of nonprofits in those areas. Is there anything you want to add to that? Or?
I was just going to say something similar to that, Robert, that as the panelists were talking, I was wondering, what the role of a New Mexico Evaluators or an Impact in Coffee or some other, many other initiatives that are going on to look at the nonprofit sector more broadly. How can we support in appropriate ways, resharing the stories you all are, generating to help amplify them if and when appropriate. And then also to address what Susan talked about in terms of facilitating ways that nonprofits can and others relevant to the sector and the work can truly come together to look at collective impact in a way that's meaningful, not just in a way that's, following the steps of what you're supposed to do with collective impact. But is there a role for some organizations to help with supporting this work, but really having it come from the nonprofit needs and what's helpful. So Robert, I think I was taking the sort of bigger picture nonprofit infrastructure look as well.
Yeah, I appreciate that. And I know, like, as someone who works in grants and grant seeking and grant writing, when we talk about evaluation, I think when people are writing grants, they're like, oh, I got to evaluate that. And what does that even mean? Like, what do I have to do? And it's like, and we never really think about like what that could actually do to impact how our program and our communities develop. And it's like, this is that one needed point that we don't like really, really push and tell stories about and how that has an impact. And not only just our daily lives, but in the work we do, the work and the change we're trying to create in our communities. And so, okay, so this is a really great portion of the conversation. I'm going to pass it back to Michael because I think he's got a different question than he wants to ask.
Oh yeah, thank you all. So this one is going to be an opportunity for you all to brag about your organizations and talk about some of the things that you're doing well. Because we always like to hear what organizations have done to change in the time of COVID, or what they've done that they see having longevity and what's having the biggest impact and all that good stuff. So go ahead and brag for a moment about your organization and some of the programs that you've started in this time, and yeah, let us know. So we'll start with Jules again.
So it's interesting that collective impact has come up because that is actually one of the things that has blossomed under COVID. We had started a collective impact process, didn't put a label at that at the time, that we started it about a year ago. But then it became very obvious during over the last 7 months that that's where we really wanted to go in order to really forward our social justice mission and build upon the intersectionality that has so come to the surface with all the work that we're doing. Whether that's food insecurity, whether that's workers' rights, whether that's public health challenges, all of it is all so intersectional. race equity, gender equity, everything has come to a head right now. And we're bringing that around to say, all right, we need to look at this as a collective impact project, to the point, and not just in the Aspen Institute's, format, but at a very organic way that's going to be built upon the nonprofits that we have here in New Mexico and our missions and our intersectional missions. And so I think that's something that's very exciting, and that's one of the things that we're really looking forward to continuing and building over the next 5 to 10 years is that collective impact project, and having it really be measured and evaluated. And that, Nancy, I think is where an external evaluator comes in that would work with, the backbone agency or with all the agencies in collaboration to say, how are we going to measure this? What is the data that we're going to look at, and what does that really look like? Because we're so hyper-focused on our own missions and our own outcomes and our own evaluations that I think it's really hard to get the broader view and see the bigger picture of how that is how is this collective impact really working, and what levers do we need to push or pull in order to have it be more impactful. So I think that's exciting, and I think that that's really where the external evaluators can work with each of the organizations within the collective.
Thank you, Jules. Yeah, collective impact is definitely something that we've all seen coming around a lot more lately. So thanks. Susan, jump over to you.
Well, thanks. One is, I mentioned earlier during the introduction that our headquarters is in Silver City, New Mexico. That's 4-hour drive one way to Albuquerque, 5-hour one-way drive to Santa Fe, where a lot of decisions are made. So I think one success that we've had throughout COVID is we relied on technology prior to COVID. And so we were actually, because we work with a lot of rural communities throughout New Mexico, so being inclusive by meeting via technology was already something that was very important to us. We already had about 1/3 of our staff in virtual offices, in home offices. So the shift over to COVID wasn't, we were already positioned, it wasn't shocking for us. We just built on what we already had in place. And there are so many advantages of using technology, especially in terms of having more voices at the table. So we've seen in virtual meetings where in a face-to-face meeting, there were maybe, 15 people, within close proximity to where the meeting place was. But now we have, 35, 40 people joining from throughout the state. So we really want to honor that and continue to use that whenever possible, even after the public health order is lifted. So, and the other thing that we're tracking really closely is the youth of telehealth. Once again, that's an access issue, and there's been so many regulations that have been waived or relaxed during COVID, and we're monitoring that. And we really want to say, hey, should these be permanent conditions to allow more availability to, whatever service or program? So we're monitoring that very closely. So certainly technology is one of those things. And then the other piece that I'll brag on just for a minute is access to data. What we're finding, things are changing so rapidly during COVID, almost on a day-to-day basis. And we have, at the Center for Health Innovation, we've been spending the last 18 months integrating the New Mexico Community Data Collaborative under the Center for Health Innovation's umbrella. And I've really been enlightened in terms of how critical and important it is to communities to have access to real-time, accurate data in order to do the planning, in order to do the response, in order to make those decisions, and really have data-driven programs and data-driven policy. And what we've found out as we've taken over that program is it's not a given to have access to data. So really working as, to make sure that we have data use agreements with our governmental agencies, that we have, it's protected, but, it should be public. And so that's something, a lesson learned for me, or how important that is, and we need to fight for that.
Thank you for that, Susan. You definitely touched on great things like technology. I know with Impact and Coffee, we've been able to have speakers from Farmington, Taos, Silver City, Las Cruces, and so that's the Impact and Coffee does want to work with all nonprofits in New Mexico, but it's been more difficult since we've been doing it in person. So I definitely see how technology has helped with that also. And then you mentioned the data access and telehealth also. So I'll jump over to Nancy to see if she wants to piggyback off of any of that. And then Shelly will end this question with you in just a minute.
I've just been absorbing the really great celebrations that Jules and Susan have shared already. I don't have anything to add, particularly at the level of New Mexico communities, but thank you.
All right, Shelly, let's hear from you.
Yes. Before I speak to the area that you asked me, I'd like to kind of go back and kind of springboard off of some of what was shared earlier about the collective story and understanding data. So the first one is that collective story around nonprofits. So coming from an indigenous worldview, there is no icing on the cake, because when my worldview looks at, if you, all across New Mexico in the Southwest, have you seen these spirals? They're most known and famous in Chaco Canyon. What I can share with you is general knowledge about it's a time, it captures time, but it also captures our migration story. So if you look at that spiral in a three-dimensional, when you pull it out and it, it's like a yo-yo or just a spiral, there's no beginning and there's no end. It continues. And that's what we when we talk about our evaluation and how we're using evaluation, that's the way we explain it, is that we are on a migration together. And the spiral goes clockwise, but it also goes counterclockwise. And that counterclockwise is when evaluation comes in, where you go back and you grab data, and so that you can move forward. So you're learning to move forward. And so there is no icing on the cake, because when you enter into particularly a Pueblo home, when they invite you to feast, Kathleen's on the, Kathleen is on this, this session, so she can speak to that. You intentionally are welcoming an extended family, or coming into an extended family. They're welcoming you. So your lifetime, you're connected for lifetime. You become part of that family. So when you can think of evaluation, and the funders can think of it that way, once they step into that space, they become family. So you're continuing this lifetime of collective stories together. So it doesn't end, you just continue that story. And then I wanted to also talk to you about understanding data. What we're seeing in New Mexico particularly is that there are a lot of tribal programs that don't understand the value of evaluation. So they get these grants, and they forget that, oh, okay, we said we would do evaluation. And right when the window of the grant is going to end, they're like, oh my God, we forgot about evaluation. So they're calling people like us. And so we have 4 months, 2 months to grab 4 years of data or 5 years of data. So there's a lot of training on understanding evaluation that needs to happen within these tribal communities and rural communities to extend it a little further. So now, things that we're really excited about is the push on data sovereignty. We are all across indigenous communities, and it's even more vibrant now, is there is a push on data sovereignty and understanding data sovereignty from that indigenous lens. And I love it. I love it that we're speaking to truth, that it does need to happen. Too many helicopter researchers have done some damage to our communities, and evaluators. The two things that we're doing or three things that we're doing is that I'm most proud of is that we are trying to engage youth in our evaluation. Youth as evaluators, you have a hook, you hook them. You give them a sense of maybe a career pathway, a support system that can help, maybe they're in college, that can help them navigate some possibilities, and we're loving it. It's just beautiful to engage youth, particularly Native youth, because as I said earlier, we need more Indigenous evaluators because our worldview is different. The second thing I am very proud of is that challenged, proud, excited, all these emotions are surfacing is my colleague and I, Jill Stein, and we do what, we don't have a term for it, we just call it collaborative evaluation. She comes from that Western lens and I come from that Indigenous understanding process, and we walk this beautiful pathway together. So we're at a tipping point where we're challenged and we need to grow. We need to grow, but we want to do it carefully. We don't want to just bring in evaluators. We want to bring in teams of evaluators to model what Jill and I are doing together for the last 16, 17 years. So a Western conventional evaluator and an Indigenous person. So we're starting to grow, seed that and grow and provide some training. And it's exciting because we're outreaching, and we do have some colleagues from New Mexico that you build on trust, and then some other colleagues that we've worked with. So we're starting to grow in that sense. The other thing that is real exciting for us, and I mentioned this earlier, is that we've taken the opportunity to track this collective story across our programs on how they're navigating COVID. So those shared experiences will be really cool to share out. Maybe it'll happen when the pandemic lifts. I'm not sure when it'll become something that we can share. So thank you.
Excellent. That was great. Thank you for that. I'm going to pass it over to Robert, who's going to ask the last question of the day.
Yeah, thanks, Michael, and thanks, Shelly, for that answer around data sovereignty. I'm Filipino American. I'm an immigrant to this country, and I know that data has been used to hurt communities of color in the past, and so to talk about data sovereignty is such a refreshing lens to talk about from an Indigenous standpoint. I mean, Asian Pacific Islanders make up 2 to 3% of the population here in New Mexico. And that data point is often used to invisibilize Asian Pacific Islanders in our community, that we are denied service, social services, behavioral services, mental health services, and the like. And it's meant for the Black community as well. They make up 2 to 3% of our population in New Mexico too. So to be seen as a minority here in New Mexico often means that from that data set that we don't matter. And so it's so important to talk about data sovereignty and how can we create data that's meaningful for our own communities so that we can build our own power outside of the institution. So I appreciate you so much. Thank you so much. So the last question for today, and I know it's 9:59, is that we always ask this question: what is it that we can do, our community can do for you today? And I will start with Jules and I'll work my way back.
I'll be quick. We are celebrating our 20th year anniversary this year as Enlace Communitario, and next Saturday, not this Saturday, but next Saturday the 17th, we are having a virtual event from 6 p.m. to 7 p.m. I will put the link in the chat so you can get more information, but we hope that you can all join us. We have an amazing live auction that's going to culminate on that day as well, so not live, but online auction. And so we've got amazing things that have been donated by our generous in-kind donors, and we're very excited to spend the next 20 years working our way out of a job. So thank you.
Thanks, Jules. I'll go to Susan next.
Hi, and I want to thank Shelly for bringing up data sovereignty, because we recognize that in working with data and how important that is, especially to our indigenous communities as well as other communities throughout New Mexico. As far as, you know, what folks can do, I think there's two things. One is with one of our projects, the New Mexico Community Data Collaborative, it really is community driven. And so, you know, having community request that data and request how to use that data or how to navigate the data is actually really helpful to us, so that we can go to state agencies and legislators and say, this is what community wants. And so it's helpful. So if you could put in your requests, or, you know, just participate in accessing and utilizing the New Mexico Community Data Collaborative. And then the other thing is we are part of a public health partnership and public health advocates. So if you haven't joined the New Mexico Public Health Association, we work really closely with them on a lot of public policies. So we encourage you to at least look into that organization if you're not already a member, and support some of the public health policy.
Thanks, Susan. I appreciate it. Nancy, is there anything you want to tie together for us before I end with Shelly?
I'll just make a selfish request that I mentioned. I'm with on the board of New Mexico Evaluators. We'd love to hear from anyone that does evaluation, whether you call yourself an evaluator or not. We're actually particularly interested in connecting better with people who just do evaluation, but you know, don't necessarily self-identify that way. We want to know how we can support this work more across the state. So I'll put my contact information in the chat too, and we have a website. So thank you.
Absolutely. Thanks, Nancy. All right, Shelly, bring us home.
All right. Again, I'm going to amplify youth and indigenous communities, indigenous individuals. We need to build more indigenous opportunities for more indigenous people to become evaluators. Science scares them, a lot of them. So how can we be good relatives and create spaces at the state level for providing opportunities, portals for indigenous people to get training, find opportunities to become evaluators, because they are greatly needed. And how can we work together to walk together to create that spiral and that pathway, so we're authentically collaborating to help grow indigenous evaluators. And my passion, I'm very passionate about youth, young adults. We have wonderful opportunities to engage them, and why aren't we doing that? Why have we not done a good job at doing that? Okay, I'll stop. Thank you so much.
We could have kept on going. I've been like, that's it for Impact and Coffee. Big thanks to our panelists today. Virtual round of applause from our folks. Big thanks to our Impact and Coffee team: Michael, Destiny, Juan, Aaron, and Brianna. They do a really great job of bringing this Impact and Coffee 3 times a month. Our next Impact and Coffee is next Tuesday, October 13th. We have a very special panel on women's health. I can't name the guests just yet because not everyone is confirmed, but join us for Impact and Coffee 9 a.m. Next Tuesday. And also a big thanks to our audience today. We had a lot of folks on the call today. We really appreciate you coming to Impact and Coffee almost every Tuesday, the first 3 Tuesdays of the month, to share your Tuesday with us. what your stories are, what your organizations are, and network too. So thank you again, and we will see you next Tuesday for a very special Impact in Coffee. And that's it. Hope everyone has a really great week, and we'll see you very soon. Thanks, guys.